Good afternoon, folks. This afternoon's topic A is too many medications, too many hospital visits. Study highlights hidden risks for older adults. Okay, so we'll dig into this presentation this afternoon for details. Here we go. Too many medicines, too many hospital visits. Study highlights hidden risk for older adults. It is pointing to a very specific issue described on the page you have opened. Inappropriate polypharmacy. Okay, give me a second, guys. Inappropriate polypharmacy. Okay. That term refers to older adults taking excessive, unnecessary, or poorly coordinated combinations of medications, which the article identifies as a major and often overlooked driver of emergency hospitalizations. Below is a clear explanation grounded in the page's contents. What the hidden risk actually is. The page explains that adults 65 plus are frequently prescribed multiple medications for chronic conditions. When these medications accumulate, especially when some are unnecessary or interact poorly, they create a hidden compounding risk that can lead to sudden health crises. This is the danger the headline is referring to. Why too many medicines become dangerous. The article highlights several mechanisms that make polypharmacy risky for older adults. Drug interactions that increase the chance of harmful side effects. Prescribing cascades, where a medication causes a side effect that is then treated with another medication. Age-related vulnerabilities. Since older bodies metabolize drugs differently, complex regimens that make it harder for patients to manage doses safely. These factors quietly raise the likelihood of an emergency hospital visit. What the study found. According to the page, researchers from the University of Bath identified inappropriate polypharmacy as a major driver of emergency hospital admissions among older adults. Their goal is to use these findings to support development of a digital tool or app that could help clinicians identify high-risk patients before a crisis occurs. Why the danger is hidden. The risk is subtle because each medication is usually prescribed with good intentions. Side effects often look like new medical problems. Families and clinicians may not realize how quickly medication lists grow unsafe. The harm accumulates quietly until an emergency happens. The Yale Medicine piece underscores that polypharmacy, taking many medications at once, poses a hidden but serious danger for older adults. While each prescription may be justified individually, the cumulative effect can quietly lead to adverse drug reactions, confusion, falls, and emergency department visits that often escalate into hospitalizations. The article frames this as a pressing public health issue, given the growth, given the growing aging population and the complexity of modern medical care. Why multiple why multiple medications become dangerous? As people age, their bodies metabolize and eliminate drugs more slowly. This means medications can linger longer in the bloodstream, intensify side effects, or interact in unpredictable ways. Even well intended or intentioned prescriptions can overlap or counteract one another. The danger is compounded by the fact that side effects often mimic new illnesses, such as dizziness, memory loss, or agitation, prompting doctors to prescribe yet another drug. The cycle, sometimes called a prescribing cascade, can spiral into a web of medications that do more harm than good. Common medications are common mechanisms that create risk. Prescribing cascade. A blood pressure drug causes swelling, which then treated with a diuretic, leading to dehydration and complexity and risk. Fragmented care. Older adults often seen multiple specialists, each prescribing medications without full knowledge of the patient's complete regimens. Cognitive and balance impairment. Sedatives, opioids, and certain anticholinergics drugs can cause confusion, delirium, or unsteadiness, which may be mistaken for dementia or lead directly to falls. Duplicate therapies. Two drugs with similar effects may be prescribed simultaneously, unintentionally amplifying side effects. Which drugs and outcomes are most concerning? The article highlights several categories of medications that frequently lead to emergencies. Blood thinners, effective but risky, as they can cause dangerous bleeding if not carefully monitored. Opioid painkillers, associated with sedation, constipation, and respiratory depression. Sedatives and sleep aids, increased falls or increased fall risks and cognitive impairment. Drugs requiring lab monitoring, such as insulin or certain heart medications, which can cause sudden crisis if doses are off. National data shows that adverse drug events account for 1.3 million emergency department visits annually in the US, with about 350,000 leading to hospitalization. Older adults are disproportionately affected, being far more likely than younger patients to require admission after an ED visit. Practical steps the article recommends: medication reconciliation, regularly review all prescriptions, over-the-counter drugs, and supplements with a primary care provider or pharmacist. Bring pill bottles to appointments, ensures clinicians see exact doses and instructions, reducing errors. Deprescribing, thoughtfully discontinuing medications that no longer provide meaningful benefit. Or whose risks outweigh advantages. adherence tools, pill organizers, blister packs, or reminder systems help prevent missed doses or accidental double dosing. Shared decision making. Patients and families should discuss goals of care, weighing whether long-term preventative drugs are still appropriate given age, frailty, or life expectancy. Bottom line, the headlines challenge. Do you really need all those medications? Is not rhetorical. It reflects a growing recognition that fewer carefully chosen medications often lead to better outcomes for older adults. By questioning necessity, coordinating care, and embracing deprescribing when appropriate, families and clinicians can reduce hidden harms, prevent prescribing cascades, and lower the risk of emergency emergency hospital visits. The article ultimately calls for vigilance, collaboration, and a shift towards safer, more individualized medication management. Okay, guys, that is A for you. I will be back on with B shortly. Give me a bit to put that together for you, and I'll be back on with that shortly. For now, Gator Wellness, take care, folks.